Welcome and thank you for joining. My name is Patrick Hurley. I am the Director of Marketing for GI at Ambu, and I'm excited to open the first in a series of webinars that we'll host in the future on this platform and going forward. Ambu has several channels that we communicate important topics to the various stakeholders, whether that's physicians or nurses or infection prevention, finance, central processing, and C-suite. These webinars will be aimed at a broad audience with topics that are relevant to all these stakeholders in different processes and different decision-making times. Today we have an important topic related to reimbursement, market access, and costs, which I think is very relevant to the finance, C-suite, and physician teams. I'm honored to introduce a colleague, Russ Montgomery, PhD, the Director of Health Economics and Market Access in North America at Ambu today. Russ, in his role, is responsible for research and analysis to demonstrate the value of Ambu's single-use endoscopes and the execution of strategies to achieve broad market access. Previously, Russ was a Vice President at Discern Health, responsible for outcomes research, cost analysis, value communication, and market access strategy. And in previous positions, he's worked at various state and federal health agencies, including the Maryland Department of Health and CMS. He earned his doctorate degree from Johns Hopkins University in Health Services Research and Policy in 2015, and we're excited to have him talk about a very relevant and important topic today. So with that, Russ, I'm going to turn it over to you.
Thank you, Patrick, and thanks all of you for joining the webinar today. Today I'm going to be walking through a series of slides and making the case for why Ambu's aScope Duodeno is a cost-effective choice compared to reusable duodenoscopes. So I'll be spending a lot of time today talking about cost, talking about value, but I'm going to start off by talking a little bit about the reprocessing challenges and the patient safety issues that come into play with reusable duodenoscopes as well, because you really cannot separate those issues from cost. And so I'll talk about why that's the case, and then also talk to you about the challenges with reusable duodenoscopes, how they drive cost, and also highlight some of the research on the true cost of reusable duodenoscopes. And finally, I'll end with a presentation of the value of single use, the case for lower cost and improved patient safety with aScope Duodeno. We'll then end with a Q&A session as well. And so if you have questions, please enter them into the Q&A box, and we'll answer those at the end of the presentation. All right, let's start off with looking at the need for a single-use solution, reprocessing challenges, and patient safety issues. The FDA has been concerned about duodenoscope contamination and infection for a number of years now. And about 5 years ago, recognizing the contamination and infection issues that they had seen across the country, the FDA mandated that the manufacturers of reusable duodenoscopes engage in a post-surveillance study. So Fuji, Pentax, and Olympus were required to study contamination rates and reprocessing failure rates by the FDA. And the FDA has recently been releasing some of those results from the study. And you can see here on your screen some of those results. 6.7% of reusable duodenoscopes that were sampled in the study had high concern organisms present. So those are the types of organisms that are commonly associated with patient infections. Examples are Pseudomonas aeruginosa and E. coli. So 6.7% contamination rates, pretty high, higher than some I think expected to see from this study, and consistent with what some of the previous research had shown in terms of the contamination rate for reusable duodenoscopes. The study also looked at reprocessing failure rates. They were trying to assess the extent to which the reprocessing guidelines that the reusable duodenoscope manufacturers put out are adhered to in practice. And you can see here the failure rates were quite high across the board. 78% of pre-cleaning steps were either not performed or performed incorrectly. That jumped up to 84% for the manual cleaning steps and 62% of high-level disinfection steps. So as you can see here, high contamination rate for reusable duodenoscopes and very high rates of reprocessing failure. And this just shows the difficulties that facilities have in successfully reprocessing their reusable duodenoscopes. And with these failure rates, you can expect that contamination and infection rates will continue to be high moving forward. And recognizing that this is a difficult problem for healthcare providers to address, and it's a significant patient safety issue, last year the FDA recommended transitioning away from reusable duodenoscopes. And you can see the quote there from their safety communication on the left. Because of challenges with cleaning these devices and persistent high levels of contamination, the agency is recommending moving away from using duodenoscopes with fixed end caps to those with either disposable components or to fully disposable duodenoscopes. So the FDA, again, has recognized the challenges with reprocessing, the significant threat to patient safety that exists with reusable duodenoscopes. And it's important to recognize how these challenges drive costs. So reprocessing challenges are not only difficult from an operational perspective for providers to deal with, but they also have costs associated with them. Similarly, the infections that can come from improperly reprocessed duodenoscopes are not only a significant issue for patients. Patient infections are challenges for the patients and for the healthcare system to deal with, but there are costs associated with treating those infections as well. So on this slide, you can see the different cost drivers for reusable duodenoscopes compared to single use. Obviously, equipment costs apply in both categories. For reusable duodenoscopes, there are significant capital expenses. The duodenoscopes themselves, the video processors, the light source, the monitors, all of the reprocessing equipment are significant capital expenses. On the single-use side, there are equipment expenses. Obviously, you have to buy the scopes, but those are going to be supply expenses. Those are going to be ongoing costs related to the number of scopes that are used. The other categories here, reprocessing, repairs, and cross-contamination, only apply to reusable duodenoscopes. Reprocessing, as we'll see in a later slide, is a very significant cost. Completing all of the steps in the various reprocessing cycles has labor costs. It has costs associated with consumable supplies and a number of other costs that really add up over time and contribute to reprocessing being a significant cost driver. Repairs are also important as well. As you'll see, those can be quite significant when you think about repairs to the scopes, repairs to the reprocessing equipment that's used as well. And we'll also talk more about the cost associated with cross-contamination and treating those infections that patients may acquire from having an ERCP with a contaminated duodenoscope. So let's go a little deeper here on these cost drivers. On the equipment side, the scopes and video towers are a significant capital investment, and those costs are spread out over a number of years as that capital investment plays out and as the scope is used over its life cycle. And we often see that hospitals need to buy excess scopes to compensate for reprocessing time and for their scopes being out for repair. These duodenoscopes are very complex with the working channel and the elevator. There are many components that can break down and need repairs, and so that means that hospitals often have to have an extra duodenoscope available for those times when repairs are necessary if they're not given a loaner. So equipment costs are very considerable. On the reprocessing side, there are over 100 individual steps involved in reprocessing a duodenoscope. And what we've seen over time is that due to contamination and infection risk, the reprocessing guidelines are becoming more stringent, and that's leading to more cost as the reprocessing cycles become more difficult to achieve and to carry out successfully. And we saw that in the FDA study I mentioned before, even with additional training and with additional resources, steps are often missed because the reprocessing is just so complex, and that complexity means higher costs. I mentioned the need for repairs. These reusable duodenoscopes get worn down over repeated uses, and the more intensive reprocessing that is becoming more common as we move towards more sterilization, that means that the duodenoscopes break down more frequently due to more wear and tear from the reprocessing cycle. And it's important to note that any scratch poses an infection risk. A scratch on the outside of the scope, I mentioned before the complexity of duodenoscopes in terms of the working channel and the elevator. There are many opportunities for organisms to get stuck and to get into those nooks and crannies in the scope and not get cleaned out. And so cross-contamination and infection is a considerable cost here as well. It's not a direct cost in terms of the hospital or the provider having to bear those costs necessarily, but it is a cost to the healthcare system, and has to be considered when you're thinking about the cost of reusable duodenoscopes. And as you'll see, we'll get to some data in a moment, those costs can be considerable. All right, we've talked about the cost drivers. So what types of costs are involved when using reusable duodenoscopes? Now let's look at the research on what those costs actually are across those different categories. And so we've taken data from different studies that have been published, and I've been able to get to a per procedure cost for each of these 4 categories of cost drivers for reusable duodenoscopes. On this slide, you see the cost for capital investment, and the duodenoscope purchase cost from the study that we reference here was just under $50,000, and that's a pretty typical cost across different hospitals. You may see some lower costs or higher costs depending on the hospital in question or the provider in question, but this is a pretty typical duodenoscope purchase cost. The cost of the video tower includes the video processor and the light source. You see the costs associated with those capital equipments from the study that we reference as well. And also for capital, you have to consider the cost of the automated endoscope reprocessor, or AER. In the study that we're referencing here, that cost was about $35,000. Now there's other capital to consider here as well. The sterilizer, lumen inspector, storage cabinets, other capital that's used in reprocessing. And what we've done here is taken all of those capital costs and spread them over the lifespan of that capital. So the lifespan for a duodenoscope is about 5 years, 5 years as well for the video tower. An AER has a lifespan of about 8 years. And so all of these costs, when you spread them across the lifespan of these capital and take into consideration the typical procedure volume, you get to a $679 per procedure cost. Now this is going to vary potentially quite significantly across providers. It depends on what they paid for their capital equipment. It depends on what their annual procedure volume looks like. So it's going to be different depending on the facility, but $679 is the per procedure cost based on the data in this particular study. All right, let's look at repair costs. And here, as I mentioned before, you need to take into account not just what it costs to repair the duodenoscope, but also the other capital equipment that's used. And this study found that the duodenoscope repair costs were about $2,500 annually per scope, and costs to repair AERs at about $5,000 annually per unit. Now these again can vary across facilities. Some facilities will have repair contracts that lay out pretty clearly what these costs are on an annual basis. In some cases, hospitals may have ad hoc repair costs as well. So it's going to vary significantly in some cases, but in this study, the average came out to about $182 per procedure when you spread that repair cost for the different capital equipment over the annual procedure volume for that particular facility. All right, let's look at the cost of reprocessing. And again, there is some significant variation here. And in fact, for this cost category, we have put in a range of costs, given that the cost is going to vary significantly by the type of reprocessing that's being completed. You can see here for standard HLD, in this study that we reference at the bottom, the cost was about $80 per cycle. Double HLD, $118, and sterilization came in at just under $300 at $296. So some significant variation there depending on the type of reprocessing cycle that the hospital or provider chooses to use. And an additional cost that is coming into play more and more often is surveillance culturing and sampling. The guidelines are moving more towards recommending that surveillance culturing and sampling be done. And basically this just means, similar to the post-market surveillance study that I mentioned earlier from the FDA, doing sampling of reprocessed duodenoscopes to see the extent to which they remain contaminated. And that is a quality improvement type of initiative that hospitals are increasingly choosing to do to get a better handle on how well they're reprocessing their reusable duodenoscopes. And the average cost of that type of program is about $110 per cycle. And so that results in a wide range here of reprocessing costs, from $80 for a hospital that is only doing the standard HLD to about $406 for a hospital that's doing sterilization and also doing the surveillance culturing and sampling. All right, let's also look at the cost of cross-contamination. And the cost here is really associated with treating the infections that result from improperly reprocessed reusable duodenoscopes. And the study that is referenced at the bottom found a 1% infection rate when reusable duodenoscopes are used. So essentially 1% of patients post-ERCP with a reusable duodenoscope will acquire an infection. And you see there the average cost of treating that infection, $47,000 on average, thereabouts. And this was calculated by looking at actual data of the common infections that occur after a reusable duodenoscope is used in an ERCP. So that's the cost of treating sepsis and pneumonia that may be acquired as a result of a contaminated duodenoscope. And this is actually, I think, potentially a conservative estimate. You sometimes see costs associated with treating sepsis and ventilator-associated pneumonia that are even higher than this number. But in this model, we're using $47,200 as the cost of treating an infection. And so multiplying the infection rate times that average cost, you get to a average infection treatment cost of $472 per procedure. Like I said, for all of these categories, there's going to be some significant variation. But I think this is a good model, a good estimate of the typical costs for an average hospital. And you can see here how all of these add together. The costs from the four categories gives you an average cost per procedure of $1,413 to $1,739. Now, there are additional cost drivers with reusable duodenoscopes that we haven't captured here. These cost drivers are more difficult to quantify and may not apply to all hospitals. So again, significant variation here, but these are cost drivers that are important to keep in mind and can add to that total that I just reviewed. And several of these are associated, again, with reprocessing. Reprocessing, as I've mentioned a few times now, it's very complex. There are multiple opportunities for additional costs to be to come into play here, from the reprocessing cycle itself, from the training and education that's needed to make sure that the staff that are completing reprocessing know what the guidelines say. Transportation to and from central reprocessing. Some hospitals or health systems will have a central location where they do central reprocessing. And so the transportation costs to and from that facility, that includes labor, but also the transportation costs itself. That's going to be minor on a day-to-day basis, but it adds up if you need to have a vehicle to transport those scopes back and forth. In addition to that, overtime can be a significant cost driver as well. If a reusable duodenoscope is used later in the day and needs to be reprocessed immediately to comply with guidelines and recommendations, then that can mean that someone needs to stay late or potentially come in over the weekends to reprocess those duodenoscopes, and that can have additional labor costs from that overtime. Availability issues are important to remember as well. If a duodenoscope is out of commission, I mentioned before that this can happen for repairs, or potentially if the reprocessing cycle is taking longer than usual, that may mean that a duodenoscope is not available for the next procedure, and there are going to be costs associated with that delay or that canceled procedure. Not to mention the lost revenue from the missed or delayed procedure. There are also risk-related expenses as well to keep in mind. The training and education that I mentioned before often comes along with a compliance program. Someone needs to be responsible for tracking the changing requirements as they come out from different regulatory agencies, from the manufacturers and others. And that kind of program can have significant costs associated with it. There are also costs associated with malpractice insurance. All physicians obviously have malpractice insurance to protect themselves from litigation. Hospitals do as well. And given the significant infection risk that comes with reusable duodenoscopes, that can be rather significant in terms of what those insurance premiums look like. And the final one here is one to keep in mind as well. It's not a cost that's going to come into play for many facilities, but when it does come into play, it can be quite significant. And that's the impact of an outbreak on the facility's reputation. If a hospital has an outbreak from duodenoscopes, outbreaks of infection in patients that have had an ERCP, that can get picked up by the news media and create a situation where the reputation of the hospital can turn negative, and that can have a significant impact on future utilization, revenue opportunities for that hospital. And you've seen that in the past. It actually it was the case that outbreaks got into the news media and caused Congress to look into the infection risk from reusable duodenoscopes because of some high-profile outbreaks that were talked a lot about in the media. So that's also one of those cost drivers that's hard to quantify, but is important to keep in mind. All right, let's talk now about the value of moving to single use. So we've highlighted the cost associated with reusable duodenoscopes, the cost drivers as you see in the research, some of those additional cost drivers that are harder to quantify. Let's look at how single use can be of value given the cost of reusables. And I want to start off by pointing out some of the additional reimbursement opportunities that are available for single-use duodenoscopes. Earlier this year, the Medicare program approved a transitional pass-through payment for single-use duodenoscopes. And transitional pass-through payments is a program that the Medicare program uses to facilitate access to new and innovative technologies, and it applies specifically in the outpatient setting. And these are not that common. Medicare doesn't issue many of these transitional pass-through payments, but it does show that the federal government believes that single-use duodenoscopes are an important technological advancement that will improve patient safety. And you see some of the details about this payment category here on the screen. It's for single-use upper GI scopes. The applicable procedures are ERCP procedures. And so this payment category includes A-scope duodeno and other single-use duodenoscopes. It went into effect on July 1st and will be in effect until June 30th, 2023. Now, this is only for outpatient Medicare. So that's a certain slice of the ERCP population or the patient population. It's not going to apply to most procedures, but one thing to remember here and to look forward to is that the Medicare program is also considering inpatient reimbursement for single-use duodenoscopes as well. Ambu has put in an application for that inpatient reimbursement, and if approved, that would go into effect on October 1st of 2021. So stay tuned for more information on that. So let's look at what that TPT payment may be for a facility. And one thing to note here is that the Medicare program recently revised the methodology for TPT, and this new methodology goes into effect on January 1st. And it actually simplifies the calculation for the TPT payment considerably. It makes it a little bit easier to understand and more transparent on what a hospital's payment may look like. So the calculation is done by taking the charge that the hospital sets for single-use duodenoscopes. So whatever they decide to charge for the scopes themselves, multiplied times the facility's cost to charge ratio. And the cost to charge ratio is a calculation that CMS does for each hospital based on their historic costs and charges. So each hospital has a unique cost to charge ratio that CMS, the agency that administers Medicare, determines. And those two things are multiplied together to get to the TPT payment. So you see there an example on your screen. Let's say that a hospital set a charge of $10,000 for single-use duodenoscopes, and that facility had a cost to charge ratio of 0.2. That would result in a TPT payment of $2,000. Now, please note that the charged amounts here is just an example for demonstration purposes only and should not be considered a recommendation on how to charge. And similarly, the cost to charge ratio is just an example for demonstration purposes. But this does give you an idea of how the calculation works and an idea of what the TPT payment may look like. It's also important to keep in mind that the TPT payment is provided in addition to the payment for the physician services and in addition to the typical ERCP procedure payment that a hospital will receive. All right, let's look at the cost again of reusable duodenoscopes. And you can see here the low range from about $1,400 and the high range up to about $1,739. Again, there's going to be a lot of variation across hospitals in the costs of reusable duodenoscopes. And so what we encourage hospitals to do is reach out to us for a customized comparison. We will collect some data from you on your equipment costs, your reprocessing costs, your repair costs, et cetera, and be able to give you a customized analysis that will estimate what you're currently paying for reusable duodenoscopes and also compare that to the cost of A-scope duodeno. And we can also take into account that TPT payment that I just described. So with that additional reimbursement for single-use duodenoscopes, what does that get the cost of single-use down to, and how does that compare to your reusable costs? So contact your local sales representative or email us-healthecon@ambu.com if you would like to request one of those custom analyses. All right. In summary, what is the value of A-scope duodeno? Well, it's important to keep in mind how we typically define value. That's outcomes over cost. We've seen in the research on the contamination and infection risk, the FDA study, that patient outcomes when using a reusable duodenoscope can be poor. The 1% infection rates may not seem like it's high, but That means that 1 in 100 patients is going to get a severe, potentially severe condition that is expensive to treat. Obviously, that has negative implications for that patient, the costs associated with the out-of-pocket stay, but also quality of life issues. So outcomes can be poor when using a reusable duodenoscope. So you have to compare that to the cost. And as we've seen here, aScope Duodeno can be a cost-effective solution for many facilities. When you take into account that reimbursements, the cost for aScope Duodeno is going to be lower than the cost of reusable duodenoscopes for many facilities. And the cost of aScope Duodeno is going to be quite a bit lower than the other single-use duodenoscope that's available on the market as well. So if value equals outcomes over cost, aScope Duodeno will provide improved outcomes by addressing that infection risk at a cost that's potentially even lower than the cost of other available duodenoscopes. There's also the potential for reduced financial risk. The costs of using a single-use duodenoscope are predictable, they're transparent, you know what you're going to be paying for each use, and they also vary with utilization. So if you, in this time of COVID, for instance, hospitals may see reduced utilization, and so when using a single-use duodenoscope, your costs are going to vary with your utilization versus using a reusable duodenoscope where you have those investments you've already made, and so you're still trying to address those costs long term. There's also the reduced exposure related to infection risk. So the liability and reputational risks are addressed by eliminating that infection risk, and that can have a big impact over time. It also relates to things like patient satisfaction, patient experience with care, if they're not facing a situation where they may get an infection post ERCP. And single-use duodenoscopes are always available. They're going to be ready on hand, can be taken out of the packaging and used immediately. And so it addresses that issue of procedure delays, which can have cost implications, revenue implications, and also just be inconvenient for patients as well. All right, well, that is the presentation on the costs associated with reusable duodenoscopes compared to single-use and the single-use value story. So now we will turn it over and talk through your questions that you've had during the session. All right. So the first question is around variation. I mentioned before in the presentation that there can be a lot of a variation in the costs across facilities. And so this question is, what can that variation actually look like? What is the low estimate and what's the high estimate for what duodenoscope may cost? So it's going to vary a lot. So it's going to depend on the number of scopes that a facility has, how efficient they are with using those scopes. So if they're very efficient with reprocessing and get those duodenoscopes back into service very quickly, so there aren't periods where those scopes are sitting unused, those are the types of situations where we see costs for reusable duodenoscopes. Some facilities are also just very good with keeping their reprocessing costs low. Maybe they are efficient with their supply use, their use of consumables. There can be a lot of variation as well, depending on the types of staff that are doing the reprocessing and their labor costs as well. We also see significant differences in repair costs as well, depending on how they've negotiated that repair contract or if they're doing out-of-pocket ad hoc repairs. So those are the big drivers of variation. Not to mention the type of reprocessing that's done. So as you saw on the slides, single HLD is going to be much less expensive than double HLD or sterilization. All right, another question here. How did you determine $80 reprocessing costs per procedure for HLD. So this comes from the published study that was referenced on the slide, and they basically followed some scopes around to look at the different costs that were incurred. So what were the different consumables that were used? So the PPE that was used, the detergents that were used, all of the supplies that were used for that reprocessing cycle. Looked at how much of each of those was used, what the facility paid for all of those supplies, in addition to the labor costs associated with carrying out that cycle. So that's typically how these cost studies are done. You follow some scopes around, you see what consumables are used during the reprocessing cycle, how long it takes to complete, and that really forms the basis for the per use cost, whether it's single HLD or double or sterilization.
Russ, there's another question in here. Great presentation. I agree. Does Ambu have single-use endoscopes for colonoscope and gastroscope, EGD? I'll take that one real quick. Yes, there's a plan to have single-use colonoscopes and an EGD in 2021.
So like the next question here is, for any of your single-use endoscopes, do you include in your IFU or DFU the limitations of reusing the same device on a single patient, such as any time limitations or what must be done to lengthen the time of use? So for our single-use duodenoscopes and any other single-use endoscopes that Ambu has released or will release, the IFU is very clear that they are single-use. They're not intended to be reused in the same patient. So they must be disposed of after one use. Now, Patrick, do you have anything else to add to that one?
Nope, that's spot on.
All right.
See this next one coming in? Yeah, do you want me to read the next one, or are you good?
Yeah, why don't you go for it?
Another potential benefit from single-use product may be with the Joint Commission inspections. I've seen this with single-use laryngoscopes. When a facility is single-use, the review is simplified because there's no need for JC to dive into reprocessing details. Yes, I think that is right. The more that the facility is familiar with a single-use platform as well as any of the endoscopes that are on the market that are single-use, the more open that facility is really to the belief that single-use is going to be more widespread across endoscopes.
All right, looking at the next question here, what are the costs of disposal per single-use scope? And does Ambu offer a disposal service for hospitals or recycling? So I'm going to let you answer that one, Patrick.
So let me see if I can do it. Okay, so what are the costs of disposable recycling? What does Ambu do? Ambu does have a sustainability program, both on the broncho side and the GI side, that the hospital can participate in. We have a partner that allows us to take those scopes back and convert most of it to energy. And then some of the parts that can be recycled will be recycled. So yes, we do have a plan. It's not just straight into the landfill. There is some partnership that needs to happen with each of the facilities themselves, and we need to identify that sort of sustainability champion, whether that's a nurse manager or it's a processor or whoever, to participate.
Right. I see a question here on how were repair costs determined. So I can take that one. The repair costs come from that published study that was referenced in the slide. And the researchers looked at both the contracted repair costs, so what did the repair contract cost on an annual basis, and any additional repair costs that may have been done separately. And that applies to the duodenoscopes, to the AER, and other capital equipment. And by looking at the total cost on an annual basis, they were able to then spread that repair cost over the annual procedure volume to get to a per procedure cost for repairs. And like I mentioned before, there's going to be significant variation in terms of repair costs and the other cost categories, just depending on the particular facility, the reusable duodenoscopes they have, and other factors. All right, I see another question here on how do I find out our cost to charge ratio?
Yep.
That's a great question. So if you saw during the slide on the TPT payments, the cost to charge ratio is a very important factor in determining what that TPT payments will look like. And I would encourage you to talk to your revenue cycle department or your finance department. That's a number, that cost to charge ratio is a number that they deal with frequently for various purposes, and they will be able to provide that to you.
I think there's another question in there, a more clinical question. I believe the working channel can also become contaminated as biofilm forms. It's not just the distal end. So how does bacteria enter the working channel? Why is the scope duodeno better for scope than just a disposable end? So you're absolutely right. Contamination can occur all over the scope. There's data to suggest that it's not just in the elevator, or at least the elevator and the distal tip, although that part of the scope is probably the most advantageous for biofilm to form because of the complexity and the challenges of cleaning, but it can be anywhere. And there is data to show that it's in the ports, it's in the channels, especially if channels get damaged with devices, as we know that they can do that. So with a fully disposable unit, you just use it once and get rid of it. And so that risk of patient cross-contamination in any other part of the scope is totally mitigated and removed.
I see another question here about reimbursements. What's the difference between Ambu and their competitors when it comes to additional reimbursements? So the TPT reimbursement that I mentioned before only applies to single-use duodenoscopes. It's an add-on reimbursement that CMS, the Medicare program, has made available to try to encourage shifting from reusable duodenoscopes to single-use. And so it's only going to apply to single-use duodenoscopes. And the typical TPT payment is going to vary a little bit from facility to facility based on that cost to charge ratio and how they set their charges. So how it compares to other single-use manufacturers is going to depend on the cost to charge ratio. It's going to depend on how they set their charges. For many hospitals, if they set one charge for single-use duodenoscopes, the payment is going to be the same regardless of the single-use duodenoscope manufacturer. One additional question here, is there any risk to the reprocessing staff during reprocessing, especially during the time of COVID? Yeah, that's a great question. And the answer, there have been some studies that have come out in the past several months highlighting the potential risk to reprocessing staff for handling a duodenoscope that may be contaminated with the virus that causes COVID. And so it is something to keep in mind. The upper GI tract has been shown to be a location in the body where there can be a high viral load. So we've seen that some hospitals have determined that it makes sense for them to move to single-use endoscopes generally to try to address this risk to their staff, not to mention the risk to patients as well. All right.
Looks like just one, sorry, Russ, looks like just one more. Have you investigated also total costs with the end of the scope, with the end part of the scope in single use? Have you investigated also total costs with the end part of the scope? I think it's asking whether we've looked at the distal end being disposable, how that affects the total cost.
Yeah, it's a good question. I think the costs that we walk through today, those categories of costs, all those cost drivers are still going to apply in many cases. So there's still capital investments. The repairs are still going to apply. And so it's going to vary. It's going to depend on the hospital, exactly what that looks like. And so that's one reason why we encourage hospitals to reach out to Ambu, and we will come and do a custom cost analysis, look at exactly what type of reusable duodenoscope you're using, whether it's fully reusable or partially disposable, and we can take that into account and give you a customized analysis to give you a better sense of what it may mean for your facility.
And with that, I do think that was the last one.
All right. Well, thanks for all the great questions, and hope you found this webinar to be informative. Thank you for attending. This webinar will be available for replay in the next week at ambuusa.com/webinars. And we're also here to answer any questions you have. Feel free to reach out to me directly. You saw my email address on the last screen, or you can also contact us at the link here, ambuusa.com/contact-us-webinars, and we'll be sure to make sure your question gets addressed. So thank you for your time, and have a good day.